joined here today with Dr Trevor Powell, and he's going to tell us a bit about what Asperger syndrome actually is.
I'm a consultant clinical neuropsychologist and diagnostic assessments for adults who think they might have a degree of Asperger's. Asperger's syndrome is something that people are born with. It's not something that you develop. You're born with a condition which is determined by the wiring up of a person's brain.
Is Asperger's a mental illness?
No, it's not a mental illness, but quite a high proportion of people with Asperger's, particularly those that aren't aware of their condition, don't have a diagnosis, suffer from significant anxiety, depression and other types of mental health difficulty.
And what proportion of the population has Asperger's?
Well, it's thought to be about 1% of the population.
What proportion of men and women have Asperger's?
Well, originally it was thought to be very much a kind of male syndrome. So the initial figures were like 10 males to 1 female. But more recently the figures have gone down, so the gender ratio is something like 3 to 1. But a lot of people would say actually it's not really 3 to 1, it's probably more like even. But the female presentation of autism or Asperger's is often more difficult to detect. So females don't get diagnosed.
And are there any differences in how men and women experience Asperger's?
Yes, I think generally men tend to be more prone to having special interests. Their obsessions are more obvious. They might have a particular interest and that's what they want to talk about, whereas women, their interests tend to be less noticeable, less extreme. Often women have got better social skills, better eye contact, and not so obviously autistic.
So what are the typical symptoms that those with Asperger's experience?
Well, I would say mainly people have social difficulties, difficulty mixing with people, difficulty making friendships, being in intimate relationships, understanding other people, being able to have reciprocal conversations. Another aspect is people often are quite rigid and inflexible in terms of their routines and how they like to do things. And other people have sensory sensitivities. They're sensitive to noise and light and smell and taste.
Like you mentioned all these different symptoms, what is like the actual impact of these symptoms on someone's day-to-day experiences?
Well, life becomes more of a struggle.
Okay, in what way?
Well, for example, if you're at work, the person might be able to do the job itself quite well, but interacting with other people, the social side of work, might become a bigger stress than the actual job itself.
What proportion of those people with Asperger's are in employment, approximately?
Well, out of the people that we see, approximately a third of people are employed.
Okay.
And approximately a third are actually in relationships, either married or with a long-term partner.
And would you say like the stress is more profound or like experienced differently? Like for instance, I know that I can have a meltdown, so can it come out differently? Can it trigger other sort of behaviours?
Yeah, well, you use the word meltdowns, and often people will say they become completely overwhelmed and have a meltdown where they might be, you just have to escape from the situation or burst into tears or start shouting, lose control.
Okay, and we said that there's no cure for someone with Asperger's because obviously it's something that they're born with. But what do you suggest for someone with Asperger's in terms of getting extra help and support? What is actually available for them?
Well, there are, what our service tries to do is to provide supervision for other psychological therapists, So people working in talking therapies, people working in community mental health teams, get supervision from people in our service. So there are other people out there that can offer supportive psychological therapy.
Okay, so that was a really fascinating interview. Thank you so much, Trevor, for taking part in that interview. We really appreciate it.